that clinical sign, compartments are soft and compressible, means nothing. The only thing from a clinical standpoint that means anything is when you passively stretch the muscles in that compartment, is their pain reasonable or is their pain out of proportion? That being said, the problem with that, of course, we all know is that we have patients that we can't necessarily trust the clinical exam, either because they're unattended, they're altered, or they're on narcotics and you breathe on them the wrong way and everything hurts. So that is our kind of problem with the clinical exam and hanging our hat on the clinical. What's our problem with single point compartment pressure measurements? The numbers are basically useless. And you really learn about this by looking at graphs. And this is one of the huge educational places. So we get these papers, and this one from Shock, and then there's the papers out of Edinburgh from Court Brown and from the Queen, looking at continuous measurement. And it's much more important to look at the continuous numbers, because the thing about fasciotomy is it's not a benign treatment, right? Like, it's not like, oh, it's a little skin wound, they're going to be okay. No, I mean, like, you get a tibial plateau fracture and you fasciotomize them, whether or not they needed it, but let's presume maybe you fasciotomize them without them actually having compartment syndrome, but you overcalled it. They get an infected tibial plateau, because the literature says fasciotomized tibial plateaus, about a third of them get infected. That's a problem, right? So you don't want to undercall it, because the sequela of undercalling it is really bad. And you don't want to overcall it, because unfortunately our treatment is not particularly benign either. If you look really kind of at the numbers, the problem with single point is, if you really need to look at the values over the course of about a 2-hour period of time, which is what the data from continuous monitoring tells us, what are you going to do?